What are the downsides of state reliance in the Nordic model? Imagine living in a society where almost everything is covered by the government, from healthcare to education. It sounds ideal, right? But there are some challenges that come with this kind of system. The Nordic countries like Sweden, Norway, Finland, Denmark, and Iceland have built their reputation on a strong social safety net funded by high taxes. While this approach has helped reduce poverty and promote equality, it also brings some issues that are worth understanding. One big challenge is the aging population. In Scandinavia, fewer young people are having children, which means there are more retirees and fewer workers paying taxes. This puts a lot of pressure on the government to fund pensions and health care. For example, Finland has a declining birth rate, and Norway and Sweden depend on immigration to keep their workforce stable. But even with immigration, the balance between those paying taxes and those receiving benefits is shifting, making it harder to keep the system sustainable long-term. Another problem is that despite the focus on equality, income and health gaps are growing. Since the 1980s, inequality has increased in many Nordic countries, especially after the year 2000. Sweden, in particular, has seen a sharp rise in income inequality. This challenges the idea that the state alone can keep everyone on equal footing. Health differences between social groups are also growing, showing that the welfare system doesn't automatically eliminate all disparities. Global crises also test the resilience of these welfare models. The COVID-19 pandemic, the war in Ukraine, and rising living costs have stretched government budgets thin. These overlapping crises, sometimes called a polycrisis, make it harder to maintain the same level of public services. Plus, there's a growing need to make policies environmentally friendly, which can sometimes conflict with economic or social priorities. Trust in government is another concern. People in the Nordic countries have traditionally trusted their governments a lot, which supports high taxes and collective solutions. But as challenges grow, maintaining that trust becomes more difficult. If citizens start doubting whether the government can deliver, support for high taxes and social programs could weaken. This is especially true as societies become more diverse and face issues like immigrant integration, where existing policies might not be enough. The reliance on specific cultural and historical conditions also makes the system fragile. The Nordic countries have strong labor movements and a tradition of consensus politics that helped build the welfare state. But as these movements weaken and societies change, keeping high levels of redistribution becomes more complicated. Some experts argue that without these unique conditions, similar systems might struggle elsewhere, and even within Scandinavia, the future of the model isn't guaranteed. Reforms are often needed to keep the system working well. Adjusting pension ages, changing healthcare funding, or updating family policies can be politically tricky. For example, raising the retirement age or cutting benefits might face resistance from the public. Balancing the need for economic restraint with the desire to keep benefits generous is a constant challenge. In the end, relying heavily on the state in the Nordic countries has brought many benefits, but it also faces real hurdles. Demographic shifts, rising inequality, global crises, trust issues, and societal changes all pose questions about how sustainable this model really is. Addressing these issues requires careful planning and sometimes tough choices to ensure these societies can continue to thrive in the future.